Should I start? All right, hey everyone. So hopefully it's showing on Zoom and wherever else. So my name is Emily Barton. I'm an assistant professor of behavioral neuroscience at St. Edward's University here in Austin. Here to present research that I did with some of our amazing undergrads. So we're primarily undergraduate serving universities, so we do all our research with undergrads. And last year, they were very interested in the impact of the prolonged pandemic and specific stressors on college students. And we specifically looked at problematic drinking. We had a second arm of the study that was looking at sexual desire and intimacy. That's fun. So whenever the pandemic initially started back in spring 2020, there was a big shutdown of all of the college campuses, universities, especially here in the US. And that left students potentially without an income if they worked on campus, potentially homeless if they were living on campus. And it also meant that all of the education was shifting immediately to online. And so many students were not used to that, especially at our home university. We did not do online education. So that was creating a lot of very new stressors for college students, as well as everyone else. And so there are a lot of concerns that this was going to really increase problematic drinking among college students. And early reports really were showing that. So it looked like a lot of students were having this spike in really drinking and potentially drinking to cope. But by later in the pandemic, it seemed like, at least from one study, that the psychological stressors or distress symptoms were lessening. But we still weren't sure what exactly was happening with drinking behavior at that time. So our main goals were to look at the problematic drinking as well as drinking to cope much later into the pandemic. So we were looking starting February 2021, so about a year into everything that was happening. Our university was still online. I know that for some, that was also the case. So it was still in that weird time where the pandemic was lessening, but it certainly wasn't gone. And we're still, I mean, even to this day, feeling effects. We also investigated sex differences, but for time, I won't be covering them, but feel free to read the paper. So our main measures were the audit C, which is going to look at basically categorizing normal to problematic or risky drinking, as well as specific questions looking at drinking behavior. So we were asking them if their drinking changed during the pandemic to either be less, more, or no change, as well as if when they drink, they tended to drink alone or with others. Because since a lot of the pandemic was isolation and shutdown, we were curious to see if people were drinking more to cope with the isolation or if they were drinking less because they weren't going out. We also used the brief cope, which is going to look at different coping mechanisms used, and specifically we're looking at the questions tied to substance use. And we also developed our own COVID-19 questionnaire. So we wanted a questionnaire that was really specific to undergraduates, so what their experience was. So our undergrads worked to actually create one. Our total item count was 38 items. 29 were original, created by our research team. The other 9 were adapted from already existing or published measures. We then ran a principal components analysis, and we came out with 8 different components that had eigenvalues greater than 1. And this was really the best model that we found, where in all of these components, the items really lined up. And so these were the main kind of stressor categories that we were looking at. And the items were presented on a 7-point Likert scale, where 0 not at all to 6 very much. The ones I'm showing here are specifically from that academic/online education concern. So that's what I'll be presenting on the most. And so as you can see, what's really being reported here is how students felt that online modality was going to impact their academic abilities and performance. So our main hypotheses was that stress related to the isolation, the actual virus, like contracting it, health issues, academics, specifically the shift to online education, living situation, and finances would be the main stressors impacting our college students and increasing their drinking. So we selected those factors based on the ones we felt were some of the most pressing for our students, or for students in general, as well as all of these factors are linked to problematic drinking or increased drinking behavior. We also believe that female students would drink more to cope specifically. So males tend to drink more in the literature, but females tend to use it more to cope. Also, we were looking at biological sex, not gender identity, because there are some suggestions that it's biological sex that can drive some of the drinking behaviors versus gender identity. So there's our main demographics. It was presented as a survey over Qualtrics. We administered it, or was broadly advertised on Facebook, Instagram, Reddit, Survey Circle, various places. So I'm sure we got many at our home institution, but we were also trying to reach kind of not just at St. Ed. So we wanted to reach out. We ended up with 377 real participants, majority female, the average age 21, and you can see the ethnicity breakdown. Then this is just some of the other reporting statistics. So clearly a high percentage are qualifying for that problematic drinking, which is of concern, but not that shocking with college students. I have no idea what my time is right now. So for the main analyses I'm going to talk about are really the two regression models that we ran. There are other analyses. If you're interested, look at the paper. So we really wanted to specifically test that first hypothesis. So we wanted to look at age, sex, those specific COVID-19 stress variables, as well as drinking alone, and seeing if those were predictors for both the audit C, which would be the problematic drinking, as well as the substance use version of the COPE. So we specifically wanted to look at both because audit C would be just increased drinking in general, but we also wanted to see if there was a coping aspect with that as well. So with our regressions. First off, we can see that age was negatively correlated. So really suggesting that as students were older, they were not drinking as heavily or using substances as much to cope. Also saw that males were drinking more. So that again is pretty prevalent in the literature. So not that surprising. But going into our main effects, we had an interesting effect with isolation stress, where it was actually negatively correlated with drinking more. This was probably driven by some weird data we had with the males in the sample, which again, I won't get into those interactions today, but it was an interesting finding. What I really want to focus on though is academic stress. So looking at that academic stress about the online education was positively correlated with both drinking more, so that problematic drinking, as well as using substances to cope. So that is pretty concerning. Also saw that drinking alone was again positively correlated with using substances to cope. Our next model, we wanted to see if, or specifically look at the impact of those stressors on the self-reported change in drinking during the pandemic. So could we predict if they would lessen their drinking, increase their drinking, or have their drinking stay the same? So this was using a multinomial logistic regression. Here you can see that academic stress and drinking alone were the only significant unique predictors. And breaking it down further, what we're really seeing is with academic stress, it was the only significant predictor when we're looking at the increased drinking. So again, that stress about that change in modality, that online education was leading to increased drinking during the pandemic. So main result that I've been hammering on about for a little bit is really looking at the stress concerning that change to online education was our leading predictor of kind of all of the bad metrics. So of increasing your drinking during the pandemic, of having a higher, more problematic drinking level and using substances to cope. So looking back at the literature, it's really kind of mixed on seeing if the impact of stress, what it has on drinking behavior. Some find a positive relationship, others have found no or even a negative relationship. But one article really cited that it's probably having to do with kind of your external motivation or like your locus of control. So if you internalize your control, then that is going to make you feel like you can kind of take it on. But if you have more of an external locus of control, then if these changes are happening to you, that might lead you to want to use substances or something to cope. And so since this stressor was so uncontrollable, so large, so immediate, and individuals may have just felt like they had no kind of control or say in what's happening. That might be why we're seeing this very kind of stark change and this really strong connection. So overall, the main implications for this is I think that it really shows that these abrupt changes to the learning modality or course structure can really have a big impact on students. And so as an educator, I'm talking to other educators, unknown, but as an educator, that's really important and something to really be considerate of, because even though we might be out of this pandemic, other ones might come, or there might be things where you're wanting to change something drastically in class, and it's remembering that this can have a large impact. And also trying to just really work with students on really building up that more internalized locus of control. So helping them understand that even if things are happening out of their control, they can still have some control over their performance, their academics, all of that. So with that, I just want to acknowledge my wonderful research team. With the asterisks are our two incredible undergrads who have since graduated, so congrats to them, as well as my faculty co-advisor, Dr. Katherine Goldey, also the award that helped pay for that advertising. So thank you.